The vaccine debate just took another intense turn, and you won't want to miss the sparks flying at the CDC's latest advisory panel meeting. The spotlight is on how COVID-19 vaccine recommendations are reviewed and the ongoing controversies over the decision-making process that affects millions. Here's the rundown from Day 2 of the Advisory Committee on Immunization Practices, ACIP meeting. The committee serving as the CDC's key voice on vaccine guidance. On Thursday, the group voted to recommend separating the measles, mumps, rubella, and varicella vaccines, MMR and chickenpox shots, for children under 4 instead of using the combined MMRV shot. They also discussed tweaks to the hepatitis B vaccine schedule, but postponed the decisive vote until Friday. But here's where it gets controversial. During Friday's discussion, committee members clashed with outside medical experts about how transparent and robust the decision-making process truly is. Some experts urged the committee to strictly stick to the scientific method when weighing vaccine risks and benefits, emphasizing the need for clear, evidence-based reasoning, especially when considering future changes. Dr. Amy Middleman from the Society for Adolescent Health and Medicine stressed that rigorous science must guide every vaccine decision, a concern shared by many who fear those standards might be slipping. In response, ACIP member Retsef Levi pointed out a tough truth. Many of those calling for scientific rigor seem confident, despite lacking strong, long-term clinical trial evidence, especially data comparing vaccines against placebos. Levi's push for deeper, more transparent research highlights a fracture in consensus about how to evaluate vaccine safety and effectiveness. Tensions escalated when Dr. Jason Goldman, president of the American College of Physicians, criticized the committee for silencing dissent and demanded clarity on how the ACIP plans to vet future vaccine decisions. He argued that without transparent dialogue, public trust in vaccines could erode. ACIP Chair Martin Kulldorff acknowledged this concern, but moved the meeting forward. On hepatitis B, the committee unanimously agreed that all pregnant women should be tested for the infection, a move supported by insurance coverage aiming to prevent mother-to-child transmission. However, the vote on whether to delay the birth dose of the hepatitis B vaccine for infants born to healthy mothers was postponed amid heated debate. Dr. Robert W. Malone, known for his close ties to Robert F. Kennedy Jr., expressed doubts, arguing that the evidence for changing the vaccine schedule is unclear and that rushing a vote would be premature. Earlier, the committee revisited a confusing vote from Thursday regarding the Vaccines for Children program, which helps cover vaccine costs for certain groups. Although Thursday's vote questioned whether children under 4 should continue receiving the combined MMRV shot or separate MMR and varicella vaccines, Friday's follow-up vote clarified that every child in the program would maintain access to these important immunizations. The meeting also delved into potential revisions to COVID-19 vaccine guidelines. CDC insiders hinted that the ACIP might narrow the list of high-risk conditions that qualify individuals for vaccination, possibly excluding groups like healthy pregnant women and infants. This proposed change has raised alarms among experts. Dr. Lakshmi Panagiotokopoulos, a former ACIP leader who resigned earlier this year, warned that such narrowing could mistakenly suggest the vaccine is ineffective, even though it remains crucial in protecting against severe disease. Professional groups like the American Academy of Pediatrics and the Society for Maternal-Fetal Medicine are pushing back. The AAP recommends COVID vaccines for all infants and toddlers aged 6 to 23 months, citing high hospitalization rates in this group. Meanwhile, maternal-fetal experts continue to advocate for vaccination during pregnancy and breastfeeding to protect vulnerable populations. On Day 1, the committee focused heavily on measles and hepatitis B vaccines. They moved to discourage the combined MMRV shot for young children in favor of separate doses. The hepatitis B discussions revealed deep divisions, with some members like Dr. Cody Meissner affirming the vaccine's safety and critical role in preventing disease, while others voiced concerns about gaps in knowledge regarding effects on very young infants. CDC presenter Dr. Adam Langer emphasized the importance of maintaining the birth dose vaccination policy, pointing to risks for infants who might be exposed to hepatitis B through household contacts or environments like daycares, even if their mother tests negative. He noted that adverse reactions to the vaccine are extremely rare and generally mild, with life-threatening reactions almost unheard of, an important reassurance amid debate. Currently, the CDC recommends giving the first hepatitis B shot within 24 hours of birth, a policy established in 1991 after it became clear many infections in pregnant women were missed. Experts view this universal birth dose as a safety net to prevent thousands of newborn infections each year. The proposed changes would delay the first dose until 1 month of age if the mother tests negative, allowing earlier vaccination only based on individual clinical decisions. Adding fuel to the fire, Health and Human Services Secretary Robert F. Kennedy Jr. has radically reshaped the ACIP by replacing all 17 previous members with largely new appointees, including several of his allies and known vaccine critics. This break from tradition, which previously involved a more rigorous vetting process, has shocked many health professionals and injected political controversy into what was historically seen as a strictly scientific committee. So what does all this mean for the future of vaccine policy and public trust? Are the new appointees bringing fresh perspectives that will improve vaccine safety oversight? Or are they undermining decades of scientific consensus? And how will potential narrowing of COVID-19 vaccine recommendations affect vulnerable groups like pregnant women and infants? This ongoing debate isn't just about vaccines. It's about transparency, trust, and how public health decisions are made in an increasingly polarized environment. What's your take? Do you agree with the committee's recent actions and the reshuffling of its membership? Or do you fear it could lead to less science-driven decisions? Share your thoughts and join the conversation. Because in public health, every voice matters.